Hey guys, today I'm going to be giving you a review about working as a healthcare worker here in the US. So I just started work like probably last week. This is June first week, and what it's like to work right now in this coronavirus pandemic situation. I just want to give you a review of what it's like to work and what are the ups and lows and what people can expect if you're in healthcare going back to work. So first of all, let me give a brief introduction about myself. I'm actually a dentist back in my country. I'm a dental hygienist over here. So I have been working now for the past 12 years to be precise, and I just love my job. My job has been the best thing ever that has happened to me. I have a wonderful 8-year-old son. So the first day going back to work was definitely a little overwhelming. I was definitely a little stressed, not knowing what to expect or what it'll be like, but luckily I have a very understanding boss who told me that she will cut short the day for me a little bit so that I can get a feel of it, and so I'm not overwhelmed. At the same time, I don't have to, work at my full efficiency while being stressed out, not knowing what to expect. So it was a half day for me. So I went to work as usual, and my office definitely looked very different. There's literally a rug. As soon as patients, they actually lock the door. They don't keep the door open. So patients have to knock the door first, and then there is a glass thing next to the main door where somebody will peep in and say, "Hello, is it you? Oh, you're a patient? Okay, you're welcome." And then they open the door, and then the patient just walks in like that. And then there is a rug which has a water base, so they just stamp on it, and when they stamp on it, they literally like I just want to show you my feet so get a better idea of what it's like. They literally stand on this water-based rug, and then they go on a little drier rug, and then they go hop onto the next most driest rug. And then what they do is after that is they will immediately do a temperature check. It's basically like a hold-on temperature check where they do not touch the forehead, but it'll probably be like an inch from the forehead. And they actually did it for me, and first it showed 95.5 and then it showed 97.5. So that was cool. And then the next thing is after that what they did after that what they did was they have this little pulse thing where they actually, you can use any of your 5 fingers and just check your pulse to make sure you don't have an active infection or something, because your heart rate is going to be naturally higher if you are fighting an infection. Oh, who's that? That was loud. Okay. And then after that, what they're going to do is they are going to basically give you a questionnaire or ask you important questions like, were you out and about recently, out of the state or out of the country, which is probably not possible because anyway they are not allowing flights outside. But probably, did you travel like more than 50 miles somewhere away? Did you stay overnight somewhere else? And those kind of relevant questions which make you more susceptible. And do you think you were in contact with somebody who had COVID-19, or simply the fact that do you know someone, do you suspect that you were with somebody who might have had this situation or might have been exposed to it, kind of thing. So all questions that probably put you under the list where you could be more susceptible to be having it, and accordingly eliminate patients if they feel that way. And it's only one patient. I mean, only the patient. I mean, the family and none of these people are allowed. So just the patient comes in, sits there on the chair very nicely, and then what happens is after that, the patient is called in, and the first thing we do is, once they sit on the chair, is they give them this hydrogen peroxide mouthwash, which they rinse with, and then and we are wearing all these P95 or whatever, the N100 masks. Now if you can see these little pimple like things on my cheeks, that's nothing but from the mask. Actually, I was wearing it all day yesterday. I just didn't realize how tight I wore it because I was like so worried. And that's when my boss told me not to use makeup, because I'm definitely makeup girl, I'm a vlogger, I'm a YouTuber, and glamour, and all these things are something which are very much inspiring for me. So I always do. This is just a part of me. So they said no makeup, because when you wear makeup, you have this little emollient on your skin, and they can actually move your mask, and you want that airtight seal right over your mask. So they said no makeup. Oh my god, I was like, oh no, I cannot wear makeup. But then I was like, okay, nobody's gonna see my face, so it doesn't matter, I can save some makeup, so that's fine. Anyway, I put makeup now for you. YouTubers can watch me, so I'm happy with that. So then I was thinking, because I drive to work usually in sunlight and I'm exposed to all the sun, I cannot even wear a sunscreen. But hey guys, it's okay to get a few freckles or a little sunburn, but it's not as bad as getting COVID-19. So I thought it's okay, fine, no makeup. So, and then then the mask actually sits on very tightly on your skin, forming this airtight seal. And after I put this mask, this whatever P100 mask, it has like 2 respirator filters, which actually last for 80 hours or something. And then we are putting this head cap over that, so it kind of has this full look, and over that we are putting a mask. And my boss said the reason we are putting a mask over this P100 N95 mask is because my breath should not touch the patient. My breath should not reach the patient, as much as their breath should not reach me, mine should also not. So we're not infecting each other, guys. So that's the idea here. It's not about protecting just ourselves as personal, but also protecting the patients from us. So that is something that was definitely something to note about. And so that was interesting. And then after that, got started to work, and this is a well-known patient of mine. She's very sweet. Her name is actually Hope. So I was like very excited to know that Hope is here, and I was hoping that it'll all go smoothly, and I won't have this sudden outcry or something within me, like, oh my god, I touched this, or I breathed some air, or oh my, I did something that might expose me or something. So it definitely went on smoothly. But the problem I encountered with the situation is that this lovely patient who actually adores me, and actually I'm her favorite hygienist, and when I was working on her, I usually ask questions about not questions, I love to talk to her about her things going on, and she loves to talk about her things. Like, we have this special bond. Then I was talking to her, I noticed something funny. She couldn't hear me, guys. That's right, she couldn't hear me. So I was like, Hope, how was your vacation? And she's like, huh? I don't mean to be mean, I can't hear you. And like, Hope, how was your vacation? So there was this 5-minute going back and forth thing, which was definitely quite odd. She's a well-known patient, I like her so much, so that was a little uncomfortable there. Not something you would like to experience in an official environment, right? You can't hear what she's saying, and sometimes I couldn't hear what she's saying. And then my friend actually just popped in, my colleague actually, she wanted to grab something, and she didn't know who I was. Literally, I was so draped up and everything. So these were the odd encounters, and I usually talk to people looking at their face, and I could not see my colleague's face, and I was asking her, like, what are you looking for? Do you need something? And I couldn't see her face, she couldn't see my face. So this was something very different, I felt. In terms of protection barriers and all, yes, we are up to date, but these were the different interactions where I felt not very comfortable. And however, some of the people in my office, they work 9 to 3, they don't even drink a cup of water, because literally taking out all this mask thing literally takes 5 minutes, and then putting it back takes 5 minutes. So sometimes we don't have that much time. It's back-to-back patients. But some of them were comfortable taking their water bottle, stepping out of the office, drinking a gulp of water, or maybe using the restroom like after 3 hours of work, and then going back to work. So definitely it's a different experience. It's not impossible or extremely uncomfortable, but I think it's more like getting used to the situation. And when I'll be going tomorrow, next day to work, I'll give you an update of how it's been like. Until then, I think it's definitely a learning process. It's always better to be safe. But if there are any healthcare workers out there getting so scared to go back to work, saying that, oh my God, I cannot go back to work. This is too scary. This is, I don't know. I don't want to take the risk. And literally, many people are actually, some of my friends, they actually think of changing their profession. No, guys, if this is what you've been doing for 10 years and this is what you love, then I think you should be doing this, but with a little bit of precautions. Yes, there's always a sense of danger. I think the keen sense of knowing that every patient that you are treating is positive is what you need to think of in mind. Is positive. That gives you a clear correlation, like no matter how close they are to you, how well you know them, all these down these years, they are positive. If you look at it in that aspect, it kind of makes it easier to treat the patient, and as well as kind of keep yourself protected. The one thing that I feel I did a mistake was at the end of the day, which I regret I shouldn't have done, was at the end of the day, after I went back, I took my mask off and everything. I usually have this other simple mask that I wear when I go out shopping and all that. I should have worn that and left the office. I didn't wear it. I just removed all this heavy gear and I was like, oh, finally I can breathe, like I just came out of from deep end of a pool or something. Okay, I took it off and then I took my bag, I waved bye to my friends and I'll see you guys later, and I left. I walked out of the office. That was the one thing. I crossed my room and all that, and then I was thinking maybe aerosols from the room can be lingering for about 15 minutes or something in the air, and what if it just came out of the room into the hallway where I could have been walking around in but that was something that it's more like we learn as we go. You want to learn a little bit of swimming even as you start swimming. You don't want to be perfect, because if you're seeking perfection, it's hard. But yes, anyone out there, I would definitely urge you to go back to work. There's nothing to be worried about or scared about. It's not the hardest thing in the world. I mean, the world has seen a lot more harder things, and we as medical professionals, we have come across a lot more tougher days. Situations, and which are like, okay, how do we manage this patient, how do we move ahead? And so it's not that hard actually. It's actually, at least you're gratified, you're happy, you're doing something you love at the end of the day. And just like I love doing vlogging with you guys, I also love my profession. So don't mind these two pimples. This is actually the marks from my P100 mask, which I really tightened very much. There's no need to tighten it that much, probably because I had this makeup and everything. Next time when I go to work, I'm going to go barefaced. I'm just going to wash my face, not even going to put any pressed powder or anything, because rather be safe and put this on. And the best thing is you don't have to waste time doing makeup, guys. Think about it that way. So you're also saving makeup and you're saving time, so that's not such a bad thing. And nobody's going to look at your face, so don't worry. I mean, okay, where is her pretty face? No, they're not going to see it behind the mask, so it's okay. All right, so that's my update for you guys. Otherwise, I love you guys, and I hope you have a good time. And yeah, so, and also something about the hair thing I wanted to mention is, hair is something that has to be put in a bun. Like this masks, they have these masks have a band on top, band on the bottom. So I literally put my hair like this in a ponytail, like this, so it was like in this kind of ponytail, and then I kind of made it into a bun kind of thing like this, and I put the upper band over here and the lower band over here, so it made it very easy for me to hold the mask here. And I'm gonna put a white thing over my head, which is going to be a cover for my head. And I also, as soon as I come home, I go directly to the shower, even though my son comes and tries to hug me. I say, Hrithik baby, please, mommy is dirty, I need to go, I have germs on me, I don't want a passenger. He's an 8-year-old, he understands. So I go take my shower, I have my towel, everything right there in the restroom. I don't have to go to the room, look for my towel or my clothes. I make sure I hang it and tell my family that this will be there, don't remove it, guys, from the restroom. It's for mommy when I come back home. So, and it's not that bad at all actually. So if any of you guys have any questions about this healthcare things or other things, please feel free to ping me again. I'm Shreya Bangalore, and I love you guys. I love doing all these vlogs with you, and if you have any other ideas or any other thoughts, please feel free to reach out to me. Until then, I love you guys. Bye bye.